back. I'm again Greg Cox, Chairman of the San Diego County Board of Supervisors, and we're to provide our continuing media and public information updates on the coronavirus. I'll just call it COVID-19. Once again, we have here today with us Supervisor Nathan Fletcher, who is serving on the board's coronavirus subcommittee along with myself. We also have with us Dr. Wilma Wooten, who is our county's public health officer, Dr. Eric Mcdonald, who is the director of the county's immunization and epidemiology services branch, Dr. Nick Ivantides, who is our chief medical officer. And we also have available today, if there are questions that come up, Jack Pellegrino, who is our logistics chief. He also serves in a role as the director of purchasing and contract for the county of San Diego. Before we begin, I know people have a lot of questions, and I want to remind everyone that the county's website should be the first stop for information. People should also call their healthcare provider for health-related questions, including questions about symptoms, how and where to go tested, and any other questions you might have. People can also call 211 for general information about COVID-19 resources, as well as basic needs such as food, shelter, and financial assistance. If you don't have a healthcare provider, please call 211 for information available about healthcare resources and to be transferred to the county's public health line. With that, we'll get right started with Dr. Wooten first coming up. And again, Dr. Wooten is our county's public health officer. Dr. Wooten?
Thank you again, Supervisor and Chairman Cox. Good afternoon, everyone, and thank you for being here once again. The current situation for COVID-19 continues to escalate with increasing cases. My report on cases is as of business day yesterday. We update our website every day at 5 p.m., so that's the information that I will have today. And then you can see the next rendition or update at 5 p.m. later this afternoon. So globally, novel coronavirus, which is causing the COVID-19 infection, has had almost 215,000 positive cases, resulting in 8,732 deaths. Now, if you look at the Johns Hopkins dashboard, you can see that that is updated about every 2 or 3 hours. So that probably is a good location to go to know what the numbers of cases are at any given point in time. But again, these numbers are as of close of business yesterday. Nationwide, there were 7,769 positive cases and 118 deaths. And in California, there were 598 positive cases and 13 deaths. In San Diego, there were, at the end of business yesterday, there were 80 positive cases to date and no deaths. And Dr. Mcdonald is going to go through the detailed demographics on our cases. However, just today, the White House Task Force reported that the majority of the U.S. cases are confirmed in 3 states, Washington, California, and New York. Testing will be focused in those states, and 50% of all U.S. cases are being confirmed in 10 counties. The most important thing I want to communicate to you today is how important it is for everyone to follow the public health directives or orders that have been issued this week to slow the spread of coronavirus. This is hard, but it's necessary, and we are all in this together. Taking the appropriate action helps you, your family, your neighbors, and the entire community, as well as the entire nation. To quickly review the actions or orders that were issued this week, all public and private gatherings of more than 10 people are prohibited, and non-essential gatherings of any size are strongly discouraged. Daycare must be limited to groups of up to 10 children in the same room, and they must remain in the same group each day with the same staff person. Those individuals 65 years and older, or anyone who has a chronic underlying medical condition or are immunocompromised should stay home. Hospitals must preserve resources and delay non-emergency surgeries and elective surgeries. Places that must currently remain closed includes schools, gyms and fitness centers, bars and adult entertainment establishments that serve alcohol and food. Restaurants may not have on-site dining in, but can allow food delivery and pickup as long as social distancing is maintained. All businesses need to enact their social distancing strategies, increase cleaning standards, and have employees work from home if possible. And businesses must suspend the need to have a doctor's excuse if someone is out sick. Everyone needs to adhere to social distancing. You've seen us do this every day since we've issued the order. And don't forget that things that we've been telling you since the beginning: wash your hands thoroughly and often, avoid touching your eyes, your nose, or your mouth, and stay at home if you are sick. These strategies help to decrease the spread of coronavirus 19 as well as other viruses. So we are asking the San Diego County community to do your part in helping to slow the spread of COVID-19. Now I'd like to invite to the podium Dr. Eric Mcdonald.
Thank you, Dr. Wooten. I just wanted to give a little bit of detail on the cases in San Diego. As Dr. Wooten mentioned, there are a total of 80. 67 are San Diego County residents. 5 are individuals from the quarantine at Miramar, and 8 are non-county residents. There are no pediatric cases amongst the COVID-19 patients in San Diego. 17 patients are over the age of 65, and the remainder are between 18 and 65. There have been 11 hospitalizations, and there have been no deaths. The health department is working on 3 groups of patients that are linked, 2 of which are travel related. There are 10 in one group and 4 in another. And then another group that is clearly community acquired is a group of 4. So 18 of the 67 residents are in these 3 groups. I do want to give a brief update on Miramar. I said yesterday that there was a plan to have 39 individuals leave to 3 other states. That flight got postponed until Friday. So actually the number of people at Miramar is exactly the same today as yesterday at 244. 4 of those individuals are in the hospital. 9 of those individuals are at the Health and Human Services care facility, which is actually off the base. Either they are individuals who are positive for the coronavirus, or they are individuals who are undergoing an evaluation for the coronavirus. There is 1 person who's scheduled to leave today, and I'll see tomorrow if they actually left. Update on the cruise situation. Yesterday, the cruise ship Eurodam disembarked all of its guests and 61 of their crew successfully to go on to their home destinations for 14 days of self-quarantine. There were 3 individuals who were transported to the hospital who had been pre-identified as individuals who needed evaluation. 2 of these individuals were treated and released, and 1 of those individuals remains in the hospital today. We have a cruise ship that docked this morning, the Disney Wonder, and like we did with the Eurodam, we had a conference call with the CDC quarantine station, the CDC cruise ship task force, the port, the city of San Diego, and CBP and others to evaluate whether it was safe to allow disembarkation. And because none of the 1,980 passengers on the cruise ship and none of the crew, with the exception of 1 individual who was diagnosed with influenza, had respiratory symptoms, it was deemed that these individuals could be safely disembarked. Some of those individuals are leaving the ship today, and some of those are leaving the ship tomorrow. That concludes my part of the presentation, and I'll give some questions later, and then turn it over to Supervisor Fletcher.
Thank you, Dr. McDonald. Just in the last 12 hours alone, I've spoken to leaders of our city, Mayor Faulkner multiple times, along with other leaders of cities, elected officials at the state and federal level, heads of agencies, the heads of major universities, business leaders, philanthropy leaders, and that's just in the last 12 hours alone. And in every instance when we have reached out to them and asked for help, they have said yes. And I think that San Diegans should take comfort that your jurisdictions and your institutions across multiple ranges are all working together in a collaborative spirit. And I think this is having a positive impact in our ability to move things forward. In addition to these individual calls and contacts around things we're doing, our sector calls continue. This is an important part of our ability to communicate information. This morning we did one with our military and veterans community. We also had one with our local legislators, our local elected officials and leaders. Separate from that, Mayor Faulkner, myself, along with other mayors throughout the region, did a call with the Secretary of Health from the state of Baja. That call was coordinated by our local consul general because the reality is coronavirus doesn't detect a border and just decide to stop because there's a border there. And so we're working on areas of how we can better align and coordinate our efforts cross-border and cross-jurisdiction, and we're encouraged by that same collaborative spirit. Today, the Metropolitan Transit System, of which I serve as the chair, had a board meeting. Our transit system is an essential service. It is a vital service. For the members of our community who are transit dependent, that is how they get to the grocery store. That is how they get to a doctor's appointment. That is how they get to the things that they need. At MTS, we have taken extraordinary steps by increasing hygiene, by increasing cleaning. We have taken steps to ensure social distancing on the buses and trolleys. That effort has been made easier by a pretty significant decline in ridership, as you might expect. But our transit system is an essential service and a vital part of what we're doing, and our transit system will continue to provide service throughout San Diego. We also stood with leaders in our immigrant community. There's been some unfortunate instances of blatant racism that we have seen, and the reality is in San Diego, we're better than that. We know that we are one community. We know that coronavirus does not discriminate based on your immigration status, your ethnicity, your gender, and we are not going to as well. And we wanted to remind the immigrant community that under California state law, you will not be denied any health care service, nor will your immigration status be impacted by seeking out care and help that you need. And I think that that's an important message that we need to continue to convey to everyone in San Diego. Next point, 72 hours ago, we stood up the COVID-19 Community Response Fund in partnership with the San Diego Foundation and the United Way. We were thrilled to have an initial $1 million contribution from SDG&E, an initial $300,000 contribution from the San Diego Foundation. 72 hours later, that fund has surpassed $4 million in contributions received with additional pledges. They range from individuals who have given $10 to some incredibly generous individuals. And we want to encourage the public to utilize that fund in two ways. One, continue to consider donating. If you go to sdfoundation.org/COVID, you can make a tax-deductible donation. Those funds will go towards ensuring food security, rental assistance, income replacement for folks that have been hit hardest economically by the challenges we face. But on that same website, you can apply for assistance. If you are a San Diegan out there and you are in need of help and assistance, while we all wait for state and federal programs to come, we know that people who live paycheck to paycheck and are missing a paycheck could be struggling, and that assistance is there and it is ready to be deployed and to be helpful. Next update, the 13 county family resource centers in our Housing and Community Development Services office closed this morning to in-person service. But it is important to note that access to these services and access to the ability to sign up for these services remains fully intact. These are critical food and housing assistance, medical coverage, other vital support programs to help low-income families and individuals. And the County of San Diego stands ready and willing to ensure that your access to those services remains there. Our Access Customer Service Center and Housing and Community Development call line is available to those who already participate and will continue to operate at its normal hours, 7 a.m. to 5 p.m. The number where you can reach that is 888-724-7240. You can also go to the County of San Diego's website and get information about how you might be able to access those services. We have language interpreter services enabled to assist us in 150 different languages within seconds. 99% of the non-English calls are Spanish, and we have bilingual staff on hand and ready to assist in Spanish. No one will ask your immigration status or check with you on those issues, and we will make sure that you are able to get there. You might be interested to know that since we started talking about the importance of social distancing, 9,125 people have used that line. That is a significant increase, 28% increase in usage. On Wednesday, we received 1,133 online applications for assistance. That is a 100% increase versus normal usage. And so even prior to closing the physical offices, folks were using the phone line and the website more often. For folks who don't have a computer or access, we do have staff stationed outside of each of these locations. In the event someone just shows up, there will be someone there who can get you plugged into assistance and help, because it is important that our family resource centers continue to provide those vital help and assistance to those who are in need. And then in closing, you know, we're all getting contacted by a lot of friends and family, or in our case, constituents who are reaching out to us for information about how do we navigate through what is a really unprecedented event, something in my lifetime that has certainly never occurred. And there is a lot of concern and there is a lot of anxiety. And I think it's really important that we all realize that even though we are keeping physical distance from one another, we're not keeping emotional distance from one another. And that the ability to connect with one another is the bond that holds us together as a society, and we have to continue to do that, sometimes in more creative ways, sometimes in more unique ways. In my home, we have a senior citizen in his 70s, and we're heeding the advice of our public health doctors to say that he needs to be in isolation and not around within 6 feet of the younger ones. So at night, the little boys go to the hallway, and they say, "Hey, Papa, we love you. Because we love you, we're not going to come down and give you the big hug and kiss we usually do, because we want to keep you safe." But they still communicate, and they still talk. And so as we go through this, finding ways where we're all figuring out how to maintain that emotional connection with one another, because we'll get through this, and this will pass. I know a lot of parents. We have school-age kids. They're all home. I think every parent has a much greater appreciation for our teachers now that we're dealing with our kids every single day. But there's a lot of anxiety about, I have to replicate and repeat what they get in the classroom. I got to teach them a new language. I got to teach them a new skill. And that's all great if you can figure it out. But at the end of the day, if your kids are loved and your kids know, hey, it's going to be okay, we can sort through and figure out all of those online learning opportunities and ways we're going to connect them and how we're going to help them. But there isn't this overwhelming sense that it's going to be okay. So make sure your kids are comfortable. Make sure that they know what's going on. Be honest with them about what's happening and tell them the steps that they can take. Our kids love going around and cleaning the cabinets and figuring out things they can do to make sure that they're helping protect Papa. And that gives them something to do, something that I never thought that they would ever do in their lives in terms of being a part of cleaning. We also have to make sure that we're maintaining our own health. Our own mental health, our own physical health, our own spiritual health. It is okay to go outside and go for a walk. It is okay to take your kids from your family unit and go outside and play and throw a ball. We want to make sure we're keeping social distancing from other folks outside the family unit, but you can still do that in outdoor ways, right? We have a crisis line if folks are in emotional distress. There is a tremendous financial stress that a lot of folks are feeling. And we've got millions of dollars in a fund to help you. We have hopefully billions of dollars of federal aid dollars coming down, but we're not going to let a San Diegan go hungry. Supervisor Gaspar and I are bringing forward a board letter to ensure that there are no evictions or foreclosures during the period of the COVID crisis. That would apply to the unincorporated areas. 2 cities are moving forward with similar efforts. We're not going to let folks get kicked out of their homes, but we know it is stressful, we know it is difficult, and we want folks to make sure that they're minding and tending to their emotional health and their physical health. And then the final point is the flow of information. Your cousin on Facebook might know a lot about a lot of things, but he probably doesn't know that much about COVID-19. So you should not listen to random people on Facebook as your source of information. We have an incredible website at the County of San Diego that has a wealth of information. If you want to read and learn about COVID-19, you can spend hours there. reading from experts, from science, for things that we know today. But the speculation and the what might happen and what could happen, the reality is the experts standing in front of you today, we don't know what the situation will look like tomorrow. And so if we don't know what the situation is going to look like tomorrow, no one online knows what the situation is going to look like tomorrow. But we know that tomorrow is going to come and we're going to deal with it and we're going to confront it and we'll update you and then we'll all move forward accordingly. But I think it's really important in these difficult times that we make sure that we're all moving forward. We have the guidance, we have the things that we know that we need to do. And if we do those things, we're going to be okay. Thank you.
Thank you, Nathan. And now we will go to questions. But before we do, let me just ask the medical professionals if they have anything else they wanted to clarify or add to at this point. Okay, and I would remind you that we do have Jack Pellegrino, our Chief Logistic Officer, who is here if there's questions on supply issues or anything related to that. So with that, I would just give one caveat. We'll call on you. We ask that you ask one question and we'll get a response. And then if you have other follow-up questions, you can get back in line and we'll go from there. Let's go ahead and go over here first.
Hi, Jennifer Dela Cruz with ABC Channel 10. We had a 20-case jump from yesterday, which, if I'm correct, is the highest single-day jump that we've had so far in positive cases. What does that indicate about whether or not the measures already in place are working?
Yeah, thank you for that question. Remember that there is an incubation period up to 2 weeks for a coronavirus, and so there will certainly be a delay of the impact of any of the measures that we've taken in terms of bending the curve downward. We're very hopeful that that is going to happen, but I would be careful to follow these numbers day by day because it may indicate who's being tested, where tests are available, when test results come back. Some of these results came back from commercial laboratories and are 4 or 5 days delayed, so I'd be careful about that. But a contribution, if you listen carefully to what I talked about with one of the clusters, increased up to 10 from previously being 8. Some of this has to do with contact tracing, identifying people who are ill, getting them tested, and adding to the numbers. So there's a combination of both of those things.
Before we go to the next questions, I think Supervisor Fletcher had an update.
Yeah, I just want to provide the mental health access and crisis line. That phone number for individuals who need help is 888-724-7240. 888-724-7240. The Family Resource Center's number to call and get access to programs and services that are available is 866-262-9881, 866-262-9881. So 2 different numbers for 2 different services. Thank you.
Thank you, Nathan. Next question over here.
Hi, I'm Claudia with Univision San Diego. So I have a question about testing. I know you mentioned before that we can do 120 tests in our county lab, but can you give us a breakdown of what it looks like if we add private labs, hospitals into this? What are some of those numbers?
You know, that's a great question. One of the things that we don't know is the total volume that's occurring in commercial laboratories because currently we're only getting positive results. We don't know how many tests are negative. There is actually a system that was briefed to us by the state today that will allow us to get those negative results so we can find out what the total volume is. Really, we only know how many are being done in our local hospitals, our local public health lab, and some of the ones that are being done by the Navy. So I can't really give you those numbers at this time. We hope to be able to in the future.
And I have a follow-up, also same with testing. I know the CDC right now is still saying that in order to get a test, it still depends on your travel history, chronic diseases, and if you had contact with someone. But we are also saying that our seniors are some of our more vulnerable population. So is there any talks about expanding those guidelines since we might be having local transmission in San Diego to include some of our most vulnerable? Since we heard of a case specifically today about a 70-year-old woman who's saying that she has all these symptoms, but she can't get tested. So just to clear that a little bit.
No, the testing situation is frustrating for everybody, both people who are trying to be tested and for physicians and for, in particular, hospitals taking care of patients in the hospital. There is a shortage of kits to begin with, and some people think a kit is like a pregnancy test you get at the store. It's like you do an easy test and you get a result. Actually, that's the components that help us identify this virus, but it turns out you have to have the right machine, and you have to have the right reagents, that is the liquids that help you run the test. It turns out that there's shortages of the reagents also, and so it's very difficult to get results on those tests. We're currently using a testing algorithm that's in our health alert, and I'd refer you to that, the one that was published about a week ago. It's a very narrow group of people. We should be updating that in the next 24 hours for our local providers, but the guidance is there.
So with those resources from the federal level saying that we might get like in Washington, California, and I know,
Ma'am,
but just to ease some of that distress.
Ma'am, we said one question at a time, and I want to follow up to answer a question that was asked before and tie it in with some things that Dr. McDonald said. Yesterday, I used an analogy with one of the media outlets, but I would like to use it now more publicly in light of the question that was asked in terms of the 20 new cases. Folks, it is very important for everybody to keep in mind, for a host of factors, potentially one of the most important being the national challenge that we have with regard to the availability of all the things that we need to do the testing, is the numbers at this point are really only the tip of the iceberg. It is very important for our community to not have a sense of security that because we have 3.3 million people living here, that 80 cases is not that significant. The tip of the iceberg is what we are able to capture, but it is fair for you all to understand that that iceberg is increasing in size under the water. And that is why it is so important for everybody in this community to heed the warnings that Dr. Wooten and McDonald and all of us are consistently sharing with you. Do not have a false sense of security in terms of the number. In some ways, I don't want to say it's meaningless, but it is not that significant. Secondly, with regard to testing and something else that Dr. McDonald said, part of the directives that Dr. Wooten has put forth do require all laboratories, private and health system, to report all test results, not just the positive ones. We need to also know how many tests are being run, the numerator and the denominator, because that will give us the opportunity to potentially do some very strategic modeling. And so, yes, we are calling on our entire region's compliance on following through with those requests. And I know, Dr. McDonald, you had something else to follow up on? Okay.
Okay, we'll go over here. Artie, one question?
Thank you, Supervisor Cox. Dr. McDonald, can you give us more detail? I mean, you didn't use the word clusters, but you did use the word clusters earlier this week. It sounds like we do have a third cluster. Can you give us more specific information and details about this latest group?
I really can't at this time. I can tell you that the initial part of that group of individuals was travel-related out of the country, and then close social network that individual was associated with, but I really can't give you more details at this time.
Okay, so is that to suggest that this third cluster is a local community spread, and does it involve our local school, a local school system?
No.
Okay, question?
Marilyn Moore with Fox 5 News. Can we get some clarification on the type of businesses that should and should not remain open, specifically thinking about nail salons, hair salons, masseuses, those kinds of businesses that there does seem to be a chunk of them that have remained open throughout all of this so far?
Well, first I'd like to say that many of the businesses have done an outstanding job in adhering to the policies. There are some businesses that are essential. I would say that hair salons or barbers might be considered essential. We're asking of those particular businesses to adhere to the social distancing and also the gathering of how many people are in their facilities if they continue to remain open. Some of those businesses have closed. I was asked also about casinos yesterday, and we found out after the press conference that the casinos have closed. as well as, if they haven't, they are planning to close. So we have identified what are essential services or businesses, and we've identified that in the health officer order. We may not have been exhaustive in our list, but as we are, in terms of which ones shouldn't remain open or which ones should remain open, we will include that and update and amend our order to include that information.
A quick follow-up to that. Is there any concern with these businesses that, hair salon, nail salons, there is close contact that happens between the employees?
Well, in
and
many of the,
patrons?
if many of you go to hair salons or nail salons, the owners are wearing masks. So and they are protected in that way. But again, if many of you have been to nail salons, if you get a pedicure, the person is at your feet. That's about 6 feet. If you get a manicure, you are across from a table. That might not be exactly 6 feet, but many of the operators are wearing masks. And if someone is sick themselves, they should not be going to these businesses. So again, we're not going to be 100% perfect, but if 80%, 90% of the businesses adhere to what we're asking them to do, we will make a significant impact for the community of San Diego.
Okay, question over here.
Hi, Jennifer Bowman with iNews Source. It's my understanding that yesterday the county said that there are no mask shortages, but a representative from Family Health Centers say that they expect to run out of all masks, N95s and surgicals within days. I'm wondering if you're offering additional measures or giving masks or personal protective equipment for these health centers on which many low-income families rely.
Well, while Jack is coming up to in terms of, we just had our meeting with our healthcare disaster task force yesterday. And that is a group that is funded by our public health emergency funds, and where we met with hospital clinic representatives and identify what their needs were. And our plan is to have a supply for about 4 to 6 weeks out. So as healthcare facilities are seeing that they are running low, they are to contact us. And we haven't received yet our strategic national stockpile. And that also is requested through the state to the feds, and that request has already been made.
Jack, do you want to? This is Jack Pellegrino. He's our logistics chief and director of purchasing and contracting.
Thank you. Just to amplify what Dr. Wooten mentioned, we in the Emergency Operations Center do have, through our CMS organization, we are monitoring all supplies, and we are looking at our supplies as well as asking the state, coordinating with the state, and also national supplies as well.
Okay, question over here.
So just to follow up there, because I've been reporting on that a little, she just mentioned there's someone saying they're going to run out of N95 masks within days, and you guys are saying you're getting them to everybody that needs them. The state has also said that they've filled all requests for equipment, but that's clearly not the message coming from hospitals. Sharp said critically low. Scripps has said short supply on equipment. So there's a real disconnect in what you're saying and what they're saying, and I hope you can address that directly, because they're not saying what you're saying.
So I can tell you 100% assurance that for N95 masks, there is no supply issue there. And actually, we have 700,000 N95 masks that are able for use, because we went from aerosol to droplet transmission. So we are currently using the droplet transmission process. So we have no shortage with N95 masks. There is a shortage of supply with gloves and gowns and goggles. That's where the shortage currently exists. But we are okay with masks, with N95 masks. We are okay in that area. Now, if we continue to the burn rate, this supply is not going to last forever, but we have enough of those masks until we can get supplies from other locations.
Just how far behind on the other supplies? And I'll step away. I understand.
I
you're
don't
saying
know what
good.
you mean by how far behind?
We're good on N95,
Yeah.
but there's a bigger issue with regular masks, gowns, and goggles. How big is the issue there?
They are low. So we are trying everything that we can do to ensure that.
We know
our-
when- how
I
long
don't,
they'll
I don't
last.
have any other answers or numbers for you.
Okay, question over here.
Eric Anderson with KPBS. I'm curious on the testing issue of kind of getting a status of how many test kits roughly do we have available? And when does that change? When do we see some of the drive-through testing opportunities and some of the other options that are available?
Sure, thank you for that question. I can tell you that our public health lab has about 250 test kits available, but they're running very low on the reagents, and I was trying to explain that before. There are several components to this. We have one hospital that has the kits and the machine, but none of the reagents, and so that is the long pole in the tent, so to speak. We don't have visibility on the commercial laboratories, but we know that because they're prioritizing hospitalized patients only, and that there is a significant delay in getting results, that they must also be having issues with the reagents in addition to perhaps the kits. We don't have visibility at the local level of that. But we do recognize that this is a nationwide problem. Talking to other jurisdictions, other states, everyone says the same thing. And so even though you may hear kits are being delivered, again, remember there are other components, which is why our main messages are that if you're not sick or not sick enough to be hospitalized or seek medical attention, you don't need a kit because you should be staying at home while you have symptoms. And even if you had a test, the results wouldn't be back in time for you, frankly, to resolve your symptoms. So that, again, I want people to get off the idea that testing is the critical thing. It's not. It's the action of staying home when you're sick that's critical.
Okay, we have one final question over here.
Yeah, Bruce Patch from News 8. As far as the degrees of separation, if someone we know, like a coworker, tests positive or the coworker's wife tests positive, when should we self-quarantine?
Very clearly, the evidence from China and actually from other locations is primarily it is household contacts of individuals who are positive, who are at highest risk. And so very clearly a household contact of a positive case should absolutely self-quarantine. Individuals who are more casual exposures to individuals that are known to be positive, it's useful to know that information, but it really gets into the mechanics of the interaction and when the symptoms began. It's really household members and very close social contacts that should be self-quarantining.
Thank you.
Okay, at this point, if there's additional questions, we'll have the doctors available and Supervisor Fletcher if there's any further follow-up. Just a couple of acknowledgments. Unlike cities, counties provide a number of regional services. And so the county is going to continue to operate. About 50% of our workforce is actually working at home now on computers and tied into doing their daily duties. But, you know, child protective services, adult protective services, child support services, public health, eligibility services are all key functions of county government. And so those functions are going to continue. They may be in a different manner, as was already pointed out. Libraries are now closed. We're not going to continue to do what we attempted to do the first couple of days. So if people have books to drop off, they can do that. But there's not going to be any library service. And now with our family resource centers, we encourage people to call in, and we will certainly work with you on your eligibility issues. You know, I mentioned yesterday that while we're in a difficult time, it's tremendous to see those businesses and organizations that are going above and beyond the call of duty. And I mentioned a couple of stores yesterday that have decided to open up early to allow seniors and people with disabilities, compromised immune systems to come in before they open up to the general public. And I know that list has grown significantly. Northgate Gonzalez, Valeria, Super 8 Foods, Big Savers Food, Cardenas, Stater Brothers, Smart and Final, Albertsons, Target, Whole Foods, all of them are making their stores available before the normal operating hours. And I would encourage anybody that's in that category as a senior, 65 plus, or disabled, or have a compromised immune system to call those stores to get the exact times when they will be open up for those individuals. You know, Supervisor Fletcher, I want to commend him for the tremendous job that he's doing in the homeless community and reaching out across the border. I know he was on a conference call this morning, but I don't want anybody to think that the other 3 supervisors aren't doing their part. I know Supervisor Kristen Gaspar has been working with the American Red Cross and the San Diego Blood Bank. We've had to cancel a lot of blood drives, and yet the blood banks are in critical need of blood. So if you are healthy, we would encourage you to call either the American Red Cross or the San Diego Blood Bank if you're able to donate blood. There's a critical need for that. And I know Supervisor Jim Desmond has been doing podcasts on a daily basis to his constituents. He's also out in going around and making contact with different groups, including businesses in his district. Supervisor Diane Jacobs has been working with the casinos in East County and certainly working with her constituent groups. So all 5 members of the Board of Supervisors are engaged, and I want to thank all of them for the work that they're doing and the team spirit that we pulled together. Finally, I just want to acknowledge that our faith-based community is reaching out to their congregations and to people in their neighborhoods to see if there's seniors that maybe can't get out, that need food or prescriptions to be picked up or errands run. And so I want to commend the faith-based organization for the job that they're doing. And so many of our nonprofits are really stepping up to help out their neighbors, their customers, their clients. And again, this is a team effort. We really appreciate everybody's cooperation and the attitude that they have, that we need to pull together and we need to work together, and we will get through this. So with that, we'll conclude the comments for today. If there's additional questions, the doctors will be available. Thank you.